Well, just days before a statewide smoking ban goes into effect in Colorado, a new report by the U.S. Surgeon General says secondhand smoke kills. The report says that separate smoking sections simply don't cut it, and that the facilities have to be completely smoke-free in order for non-smokers to be protected. Dr. Michael Parra, medical oncologist from Swedish Medical Center, joins us live in studio this morning to take a closer look at this report. Good morning, doctor.
Good morning, Allie.
Was this a shock in any way to you as a doctor? Because to many people, this is a really big deal. It
was a huge shock because the Surgeon General, when he came out, made a very striking statement that's a monumental decision in the United States for approximately 126 million Americans that are associated with smoke in the environment. And basically he said that no amount of cigarette smoke for secondhand smoking is safe.
Let's talk about the report and what it entails. This is years of studies that have gone into this determination.
Over 100 studies they looked at over the last 20 years since the last report in 1986. At that time they concluded that secondhand smoking was not safe, but they didn't know exactly the amount that was not safe. This report actually looked at over 100 studies that said that no amount is safe for anyone, including women, children, and adults with respiratory disease or heart disease. It greatly increased the risk of developing lung cancer and heart disease.
Can we quantify how many people are affected and how many people die from secondhand smoke?
There was a study in 2005 that they actually talked about in this particular study that the Surgeon General referenced yesterday. It's discussing about the fact that there were 3,000 people that were going to be dying from lung cancer from secondhand smoke, approximately 46,000 people dying from heart attacks, and approximately 430 infants from sudden infant death syndrome in 2005.
Wow, those are shocking numbers, and I know there are a lot of people out there who are thinking, I grew up in a household where my parents may have smoked, or I was in a car often with someone who smoked. What can those people do now, and what do they need to do to try to protect themselves if they were exposed, say, at an early age?
It's something I think that we have to be careful of, because we found out that any amount of secondhand smoke, even at a very, very small amount, even at an early age, was dangerous. So what we've had exposed before in the past, we can't do anything about, but we have exposed in the future, we can do something about. The Surgeon General reported that the best thing they could actually talk about is complete banning of all cigarette smoking associated with secondhand smoking and secondhand cigarettes exposure in the United States.
Pretty scary thought, isn't it? So if you're in a restaurant or if you're near someone who is smoking, the best thing you can do is to just get away from it?
Well, they actually referenced two reports from New York and from Boston where they've actually had comprehensive smoking bans, where they talked about the fact that it's worked out very well, and they thought it was going to hurt the hospitality industry, and it has not. So there's probably going to be a huge influx of smoking bans across the United States in most of our major cities. But at the end of the report, they did actually conclude that the best thing you could do is not have secondhand smoke associated with your children, either at home or in the environment, in the car, or at school or at daycare. They also talked about the fact that asking people not to smoke around yourself and around your children. If you have any history of respiratory disease, history of heart disease, or any history of any breathing problems, not to be associated with secondhand smoking. That was the recommendations they had, and they're going to be far sweeping and probably affect most of what we do in the United States for cigarette smoking.
Well, major news yesterday from the Surgeon General in this report. Thank you for coming in, talking to us about it this morning. We appreciate it, Doctor. Tom?
All right, thanks very much. 8:18, time now to check in on Wall Street with WB2 business reporter Nicole Pedalides at the New York Stock Exchange to check in on that first hour of trading this morning. Hi, Nicole.
Morning, Tom. Good Wednesday morning, everybody. Well, share prices right now are to the upside as the Fed's Open Market Committee starts off a two-day meeting on the economy and